Acne scars are a common dermatological concern that can have a significant impact on a person's self-esteem and overall confidence. They are the result of the skin's natural healing process after severe inflammation caused by acne. There are several types of acne scars, each with its own characteristics and treatment options. Understanding these types can help individuals choose appropriate treatment methods in consultation with a dermatologist. Ice pick scars. These are narrow, deep, and pitted scars that resemble small, round holes or large pores on the skin's surface. They are typically caused by the loss of collagen and elastin fibers in the skin during the healing process. Ice pick scars often require more aggressive treatment methods, such as laser therapy or chemical peels. Boxcar scars. These scars have well-defined edges and a box-like appearance with flat, broad depressions. They can vary in size and depth. Boxcar scars are often a result of inflammatory acne and are commonly found on the cheeks and temples. Treatment options include dermal fillers, laser treatments, and microneedling. Rolling scars. These scars create a rolling or wavy texture on the skin due to fibrous tissue bands pulling the skin downward. They can give the skin an uneven appearance and are often caused by long-term inflammation. Subcision, which involves breaking up the fibrous bands beneath the skin, along with techniques like microneedling, can be effective for treating rolling scars. Hypertrophic and keloid scars. These scars occur when the body produces excess collagen during the healing process, leading to raised and often discolored scars. Hypertrophic scars remain within the boundaries of the original acne lesion, while keloid scars extend beyond those boundaries. Treatment options may include corticosteroid injections, silicone sheets, laser therapy, and surgical removal. Post-inflammatory hyperpigmentation. Although not technically scars, PAH refers to the temporary darkening of the skin that can occur after an acne lesion heals. It's a result of increased melanin production in response to inflammation. It often fades over time but can be treated with topical lightening agents, chemical peels, and laser treatments. Atrophic scars. These scars result from the loss of tissue, often due to the body's inadequate production of collagen during the healing process. Atrophic scars can be further categorized into ice pick, boxcar, and rolling scars based on their appearance. Treatment options include dermal fillers, laser therapy, microneedling, and surgical procedures like punch excisions. PIE post-inflammatory erythema. And pitted PIE refers to red or purplish flat marks left behind after an acne lesion heals. Pitted PIE, on the other hand, is a combination of discoloration and a depressed scar. Both conditions can be treated with various laser therapies, chemical peels, and topical treatments. It's important to note that treatment plans for acne scars vary based on factors such as scar type, severity, skin type, and an individual's overall health. Consulting a dermatologist is crucial for determining the most suitable treatment approach. Additionally, patience is required, as most treatments take time to yield visible results. Combination therapies, such as a combination of laser treatments, microneedling, and topical agents, are often recommended for more comprehensive and effective scar reduction.